There's little worse than having a dog who's scratching all the time, keeping you all awake at night, constantly feeling miserable, while they're scratching themselves to pieces. In fact, I liken a dog who is always itching to a dog who is in constant pain. It's really that bad. So today I'm going to run through the main ways we can treat a dog with skin allergies and discuss the 6 main options that can make up a successful skin allergy treatment plan to stop your dog scratching all the time. Hi, I'm Dr. Alex from ourpetshealth.com, helping you and your pet live a healthier, happier life. So if that's something that you're interested in, make sure you hit that subscribe button down below. But for now, let's jump into my 6 steps or my 6 options for the treatment of skin disease, allergic skin disease in dogs. And the first thing to consider is that you really need to be certain of the diagnosis, because there are lots of other causes of scratching, not just allergies. So make sure you check out my other video on the causes of scratching in dogs. But that can be things like fleas, it can be infections, it can be mites. There's lots of different things that can cause scratching and long-term scratching in dogs, not just allergies. And because we're talking about a disease that's going to be with your dog for the rest of their life and is going to need management, for the rest of their life, maybe with some exceptions which I'll come on to, it's really important that you've got that diagnosis right to start with. And so once you've got that diagnosis, the second step to treating a dog with skin allergies is to avoid what we call flair factors. So that's other things that will cause dogs to itch. So a dog who's got a skin allergy is really going to be super sensitive to anything else that's going to cause them to itch. It's not going to take much for anything else to just tip them over to the edge and for them to start going crazy because they're so itchy. So that involves things like controlling fleas and actually preventing fleas. So having a regular preventative treatment plan for fleas. And again, I've got another video that I'll link in the description down below about that. It involves trying to minimize dust mites. So just doing your normal vacuuming, kind of washing, bedding, and all that kind of thing, paying a particular attention to corners of rooms, just to try and reduce the dust and the dust mites that inevitably build up in our houses. Similarly, reducing pollens. Now that's often not possible completely, depending on what your dog's allergic to, but if, for example, you know that they get especially itchy after running through long grass that's all in flower and pollinating, then try and avoid that. So avoiding things that cause your dog's skin allergies to flare up. It can be avoiding food ingredients if you know that there's something in particular that, again, adds to their level of itchiness. We also need to identify and treat any skin infections promptly. So an allergic dog is much more likely to develop bacterial or yeast skin infections. And so we need to kind of identify that at the early stages to treat that effectively. And often when we're doing it early, we can treat that with topical treatment, so be that creams or shampoos. But then as things go on, maybe we do need oral medication, so anti-fungal medication or antibiotics to treat that infection. So really, we want to be avoiding and managing flare factors to the best degree as possible. So the third consideration in treating a dog with skin allergies is to actually optimize their skin and their coat condition. And there's a number of different ways that we can do that. So there are shampoos that have been shown to really have an effective anti-itch effect, either during a flare-up or as maintenance. But certainly during a flare-up, if you're finding that your dog is starting to get a little bit itchy, and they include things like Alomil, the Duoxo Calm as well, and they so kind of washing your dog in those, as well as kind of washing out all of the pollens and things that are building up in your coat. They actually do have a proven anti-itch effect, and I'll leave links to those down in the description below. Now, other shampoos can be used to maintain, so those ones are a little bit more expensive, so really are best kind of saved and used when your dog is having a particularly itchy time and they're having a flare-up of their disease. But we want to be using other shampoos just to maintain their coat condition, to make sure that they're not getting greasy, they're not having scale built up. Again, we're kind of flushing, we're washing out all of the pollens and the different things that cause your dog to be itchy from their coat. Depending on your dog's skin type and their coat type, the best shampoo will vary, but on average, for your average dog, then using an oatmeal based one is often the best thing to consider. So we really want to be avoiding anything that is soap based or any human shampoos, because they can be very drying. They're really good at stripping the oils from a dog's coat and skin, which actually then causes more problems with itchiness. Now, if even using an oatmeal shampoo or another shampoo that maybe your vet feels is more appropriate, if you're finding that the skin is still becoming a little bit dry or the coat's becoming dry, then that's when you can consider using a moisturizer or a conditioner after you've shampooed them. And then The other way we can optimize kind of skin and coat quality is actually thinking about ear problems. So a lot of allergic dogs, they've got chronic intermittent ear problems. They often get really waxy ears, which then leads to inflammation and infection. And so we can think of the kind of the lining of the ear canal as just another part of normal skin. And so to try and prevent ear infections, we can consider regular ear cleaning. So using an ear cleaner, it will help mobilize the wax. It will help get the wax out of the ear, so we're not getting that build up there. They also have a drying effect, and they have an antibacterial effect as well, and an anti-yeast effect. So while they're not particular antibiotics or antifungals, they will have an effect to just dampen down any overgrowth that's going on there. And then the fourth part of treating skin allergies in dogs is to use anti-allergy medication. And there's a number of different things, again, that we can use for this. So short term, we can use topical steroids, so something like Cortivance, and that's really good as well. So it's a spray, you just spray onto a particularly itchy patch, so it's much better for localized areas. So when you've just got one particular area that your dog kind of really targets all the time, then something like Cortivance is a really good idea to just dampen down that inflammation and control the disease. There are also creams and things that you can use as well, especially if there is a little bit of an infection building up. Now, prednisone is another drug that we can use. It's very cheap, it works, but there are side effects which can be pretty severe. And I've done a separate video all about steroids and prednisone treatment in dogs and cats, so you can check that out. Again, I'll leave the link down in the description below. Really, we're fortunate that we've got a couple of other drugs that have really only kind of become available in the last few years. So Apoquel is a really targeted treatment for allergic skin disease. It also has some anti-inflammatory action. It's a medication that's generally very well tolerated. It doesn't come with the side effects of steroids, and so it's definitely something to consider, and it's probably the better option. Well, it's definitely the better option if we're having to treat a dog long term with oral medication. And then more recently, we've got a drug called Cytopoint, which is really a highly targeted treatment that doesn't work in all allergic skin disease, but instead works just for atopic dermatitis. So that is, if you think of that like a hay fever for dogs, it's when we've got an allergy, a specific allergy to pollens and other things kind of floating around in the environment. So it's a specific form of allergic skin disease. But what Cytopoint is, it's an injection. It lasts for about a month, depending on the dose you're given, and that actually the dose that is licensed depends on where you are in the world. So in some parts of the world, we're giving an injection, it lasts for 1 month, and we give a treatment every month. In other parts of the world, the dose that's licensed is a little bit higher, and then it tends to work for maybe 6 weeks, maybe a little bit more, and the aim of that is that we actually give an injection when the itch comes back. Now, whether that's the best idea or not, is up for discussion, but you might read different things as the bottom line about what the appropriate dose is for that. But Cytopoint seems to work incredibly well. It's very good at maintaining a dog's treatment so that they're really not itchy at all, but it may not be appropriate for all allergic cases of allergic skin disease, like I say, and it may also not be appropriate to start treatment with, because it doesn't have that anti-inflammatory effect that may be really important to get a dog who's already itchy to stop them itching. Now, there are other drugs that we can use that we often will use maybe in addition. So antihistamines can potentially be used. They're really not as effective in dogs as they are in people, so they may provide a small benefit, but the response actually is highly variable, and so they shouldn't be relied upon as the sole treatment, and some dogs really are just not going to respond at all. And also only specific antihistamines will work, so we can't think of antihistamines all as the same thing. So they are something to consider, but they're not the be-all and end-all. And then other less common drugs that we use include things like interferon or cyclosporin as well. Right, so diet is the fifth piece of the puzzle when it comes to treating allergic skin disease. And that's really because we can get food allergies. Now, food allergies, they're not as common as a lot of people will make out, but the only way to diagnose them is to do a diet trial. So what a diet trial is, it is feeding a novel protein and carbohydrate to a dog. So that is a protein source, and ideally a carbohydrate source as well, that they've never come across in their life. So that can be challenging. That said, there are a few what we call hydrolyzed diets, which are very effective and kind of gets around this fact that a dog may have eaten the kind of the main components. But yeah, a diet trial is the only way to diagnose a food allergy. You might read about blood tests that there are to find out what a dog is allergic to in the diet, but really they don't work. They're not reliable at all, no matter what you read, by generally the people who are kind of selling that test. Really, they're not appropriate. Now, blood testing, I'll come on to that for other forms of allergic skin disease in my next point. So they're not useless for all forms of allergic skin disease. But the other thing we need to think about with diet, we need to be storing it in a clean, sealed container. We want to try and avoid warm and humid areas, and that's really to reduce storage mites that kind of naturally can contaminate certainly kibble, so dry dog food, if we're storing it inappropriately, especially if it's a big bag, a big batch that we're storing inappropriately for a longer period of time. Now, diets that are particularly beneficial to skin also include omega-6 and omega-3 essential fatty acids. Really, they have a beneficial effect of improving the skin barrier function, so it makes the skin become a lot less leaky, if you like, to the things that are trying to cause the itch. But our essential fatty acids, they also have an anti-inflammatory effect, so they can just reduce the inflammation that's going on within the skin, and so, as you can imagine, reduce the level of itch. Now, these things are included in skin-specific diets, as well as a few other bits and pieces like higher zinc levels that can really just improve skin condition, and skin diets make a massive difference. That said, you can also add supplementation with our essential fatty acids, so our omega-6 and our omega-3 fatty acids, and there are a number of different sources that you'll see for those, but really a fish-based source is by far the best. So an oily fish, so typically that would be cod liver oil, and that's much better than using something like flaxseed oil, which is something that a lot of people will do. And the reason is that flaxseed oil, the components within flaxseed oil need to be converted to other fatty acids to have that anti-inflammatory effect, and dogs really aren't able to do that efficiently. So it might have high levels of omega-6 and omega-3 fatty acids, but they're actually not available for use by the dog. So if you're going to supplement, then supplement with a fish oil. But talk to your vet before you're doing that, because not all fish oils are appropriate. There are problems with some, so they might have, if you're talking about human versions, they might have a sweetener added, they might have extra vitamins added, and both of those things can actually cause really serious diseases, or even be fatal if we're thinking of sweeteners with something called xylitol, which is absolutely deadly. So talk to your vet before supplementing with any type of oil, unless you're giving a skin diet, in which case you don't need to supplement with extra oils at all. And then finally, at number 6, as I've just mentioned, blood tests do play a role, not with dietary allergies, but with atopic dermatitis. So when a dog's got essentially a bit like hay fever. So what we can do is we can take a little blood test, we can send that off, and we can find out exactly what it is that a dog is allergic to. Now, ideally, that would then allow you to kind of help your dog avoid those sources of things that are causing itch. The problem is that often that's pollens that are in the trees and kind of where you live, and there's just no getting away from that. What we can then do, though, is we can give something called immunotherapy. So that is essentially like a vaccine for the thing that your dog is allergic to. And what we do here is we give an injection. We start off maybe every 2 weeks, but then drop it down to maybe monthly. Really, it depends on what your dog's allergic to, how many different things they're allergic to, and the kind of the vaccine manufacturer's instructions. But this vaccine is made specifically for your dog, and we'll have these course of injections, like I say, often for a month, over the course of generally for a couple of years. This is the only treatment that has the potential to cure a dog of atopic dermatitis. So, really that can be quite powerful. This is a disease that typically comes about in the early stages of life. So we'll get this developing between about 1 and 5 years of age. So, that's potentially then a long time that a dog is going to have to live with its allergic skin disease. So if we can cure it, fantastic. The downsides are that the allergy testing and the immunotherapy, they are going to be a little bit more expensive. But again, if we do manage to cure, and not every dog is going to be cured with this treatment, but if we do manage to get a cure over the lifetime of your pet, then of your dog, then actually the treatment might work out much cheaper in the long run. So those are the 6 things to consider, the 6 categories to consider when it comes to treating a dog with allergic skin disease. I'd really love to hear your thoughts on that. If you've got a dog with allergic skin disease, what are you already doing to treat them, to manage them on a long-term basis? Have you had any problems with that, with side effects, or just struggling to control things? That's not uncommon, and I often say to my clients and to my patients that really skin disease can be incredibly frustrating because there's no one size fits all, and it can take some time to work out exactly what is the best treatment for an individual dog. And that's for a number of different reasons. Like I say, because there's no one size fits all and response can be different, but also because the response can take some time before we can see the benefits. So in the case of kind of dietary management or adding supplements, you know, it's going to take 8 to 12 weeks before we're seeing the benefit or the true benefit of that. So things can be very frustrating, but stick with it, consider all of these different things, and I'm sure your dog will be nice and comfortable and they won't be scratching all the time, and the flare-ups that happen won't be as frequent, as won't be severe. But for now, that's it from me. I'm Dr. Alex. This is Our Pets Health, because they're family.